Dr. Edward Lathan, look, man, thank you so much for taking the time out of your day to have this conversation. This truly means a lot because, you are spending literally every waking moment in the hospital, right? Saving people's lives, and the knowledge that you're able to share here can also do the same. So again, I want to stress how thankful I am for you to give your time to us.
And thank you for the opportunity to speak about this very important matter. And I have to tell you, I don't spend every moment in the hospital, but I will tell you when I'm not in the hospital, I'm certainly thinking about what I need to be doing so that I'm prepared when I return.
I'm sure you are, man, and I'm sure it's a heavy burden to carry. So can you tell us a little bit about who you are and what you do? Because you were one of the very first doctors who came out of the New Rochelle area to actually see this, or you lived in that area.
Sure. I'm an emergency medicine physician. I've been practicing emergency medicine for over 20 years now in the mostly greater New York City area, also down in Georgia for a good while. And I live in New Rochelle. So New Rochelle, as we all know at this point, was one of the original hotspots for the coronavirus. And my children and their mother live on the other side of New Rochelle, and they were actually in the containment zone where the original 1,000 members of the synagogue were quarantined or at least contained after a member of their community was contracted the virus and became very ill. So I've had a very intimate experience with this, one as a member of a community, as a father, and certainly as a physician. It was only a week or two after after it first became apparent that the coronavirus was in New Rochelle that we began seeing patients in our hospital. I work at a hospital called Montefiore Mount Vernon Hospital. It is the town over from New Rochelle. So not only was New Rochelle beginning to see patients that were fitting the description of COVID-19 infection, but so were we right next door.
So what is the difference that you've seen in the patients before this pandemic to now, today?
Sure. Before the pandemic, we saw a variety of patient complaints. We saw many children. We saw adults. They came with fevers. They came with colds. They came with flu-like symptoms. They also came with heart attacks and strokes and chronic conditions that needed daily management: diabetes, hypertension, COPD, asthma. Many things, many kind of conditions these kinds of conditions which are endemic in the community and typically are one of the reasons why people will come to the hospital.
Right. And what you're seeing today now and how that differs?
So, now that everyone is on lockdown and there's certainly now we're dealing with the COVID-19 infection and pandemic.
Yep.
We're seeing very, very ill people. I mean, certainly you're in an emergency room and you expect to see very sick people, but frankly, before this, we were doing a whole lot of just basic management and, occasionally to get someone who required like a super acute life-saving techniques in order to save their life and then provide them with the ongoing care that they would need. But now we're seeing that many of our patients, far more than half of what we were seeing before, are requiring acute life-saving care and over longer periods of time. We're not seeing too many children now because the children are going to the critical care centers that are designed specifically for children, and people understand that when you come to an emergency department nowadays, there is an increased risk of getting infected with COVID-19 because, frankly, the majority of our patients in the departments have the infection or are at risk for the infection or showing signs and symptoms of the infections. Now that we've been in this for about 3 to 4 weeks now, it's pretty evident as soon as someone arrives whether or not they're at high risk of having the COVID-19 infection.
Interesting. Wow. So can you tell us, how is COVID-19 different from the flu in terms of how it affects patients? Because I think that we're getting a slew of different answers. When you watch news, you hear from people who think they have it and so on and so forth.
Sure. They're actually more alike than they're disalike, frankly. And that's why there might be some confusion involved. They both are spread through respiratory droplets. So we spread it primarily through coughing or sneezing, touching our faces and touching other people's faces, putting our hands on other things that are contaminated with our respiratory droplets, and then someone else can touch and pick those up, the same viruses, and then introduce those viruses into themselves and get sick. They have typically the same type of symptoms, maybe a low-grade fever, sometimes a super high fever, you get body aches, sore throat, sometimes you get a runny nose, but you don't see that so much in the COVID-19 infections, but you can sometimes. You can get a really bad headache with either of them, but it tends to be worse with COVID. So there's a lot of crossover with regards to how people complain, what people complain about. And frankly, when we're seeing during the flu epidemics, they come in with nausea and vomiting. It's a multi-system condition. That's how I usually describe the flu to people, because it affects you from head to toe, right? Yeah. It does in a very similar manner. It does the same thing with COVID-19. Will do very much the same thing, except what is distinctly different between these two infections is, one, the incubation period. So when you're exposed to someone who has the flu, typically within 2 to 4 days, you become symptomatic. You have the fever, you have the runny nose, you have the cough, you have the body aches. With the COVID-19 infection or SARS-CoV-2, you actually can be asymptomatic, or the incubation period, you can actually have the virus in your body, but actually become sick for almost 2 weeks. So that's 14 days compared to a 4-day period where you are carrying the virus, but you're not actually sick. So that's one big difference. And the other one is that the degree, the amount of pneumonias that we see in the patients who have the COVID-19 infection is mind-blowing. I mean, I've never seen so many patients present with pneumonia, and it's almost like we're not even surprised when we see it. It's like, oh my God, another one. Oh my God, another one. Yeah. And then now it's okay. We're sure this person has this problem. What are we going to do? Are they sick enough to stay, or are they not so sick enough that maybe they can go home and potentially do well at home and not require hospitalization? Right. And the other thing, so that there's 3 things that I think are also very different about the two flu and the SARS, COVID-2, is that usually when you get sick with the flu, it's usually a week, maybe 2 weeks. But when you get sick with the COVID-19, I'm hearing a lot of patients who are coming in and say, I've been sick for 2 weeks, I've got this fever, and I'm telling them that, you know what, this can actually last 2 to 3 weeks. So the disease course is much longer, and certainly if you have more of a complicated course, you could be in the ICU, you can be intubated and be up there for 4 weeks, 5 weeks at a time.
Wow. So my biggest thing when I look at this, and the thing that's scariest, is that the research in terms of African Americans is alarming, right? Like African Americans, like we are dying at a significantly higher rate than white people. So what would you say is the case? And are there perhaps underlying health issues that are causing this? There's so many myths.
Yeah, sure. So first of all, it's an infection, and it's very important for everyone to know, especially people in our community, that none of us have immunity. And what that means is that none of us have we've never seen this virus before. I know our bodies are exposed to things since we've come into the world through our mothers. Mm-hmm. And our mothers give us antibodies that give us strength and resistance to certain types of infections, and we get sick and we get colds and we get exposed to stuff. But this is something that we have never seen before. That's why they call it novel. It's a new one. So we're all going to get sick if we get it. Okay. Right. So that's one thing. Nobody's protected from this. African Americans as a community generally do not have the same access to healthcare as the majority of folks. Okay. So we're just going to make it simple. White, I'm going to call it white and black. Okay. Yep. Black folks, Latino folks, colored folks, they tend to have a little less education. Therefore, they're working a little harder. They're working month to month. They are having typically multi-generational families, multi-generational homes, because they have multiple members in a family trying to work all together so that they can survive and pay the rent. So And they're afraid of, one, they're concerned about their health care, but they're more concerned about going out to make a living so that they can feed their families and pay the mortgage or pay the rent. So that if they do get sick, they're going to wait to the last. The one, they're concerned about whether or not they can pay, and two, they're going to wait to the last minute before they actually realize that they have to go accept the reality or accept that they're sick enough to go to the hospital to receive care. And most of that is often is because they don't necessarily know whether or not they can afford the care. The other part to that is, historically, Black folks don't have regular health care. Whether it's, and maybe that's part of the educational component because it's not stressed as being very important, but they don't have a doctor that they see every month and get regular monthly checkups, from an early age. Maybe they have a pediatrician they saw, but then they leave, then they go become adults and they're on their own, and they don't, and most of our younger generation these days anyway don't have a regular doctor that they see, or they go to the clinic and they just go to the urgent care centers. And so they don't have an intimate relationship with someone who knows them and can say, hey, you need to take your medicine. You need to come back here. Your mother and father had high blood pressure. You're at risk of having high blood pressure. Let's make sure we make that diagnosis in your 20s if you're going to have it. And let's talk to you about maybe lifestyle changes or considerations or dietary considerations that you might be able to protect yourself from developing those conditions. And so often what happens is that you get members of our community in their 30s and 40s who have undiagnosed high blood pressure and diabetes. And as a result of that, they now have a disease that they now have to take medication for, or will get very sick from, and that will be the very first time they present with this disease. So what's happening now with this infection is it's shining a light on the disparities of the healthcare system, because Black folks within our community, there's high blood pressure, diabetes, obesity, asthma, are all conditions that are endemic within our community. We all have uncles, cousins, aunts, grandmothers, and extended family members who have these conditions. Many of us smoke, many of us drink alcohol, and all of these factors contribute to your risk of having a really bad outcome when it comes to an infection with COVID-19. You couple that with how quickly this virus spreads, and that we're all living closely. Many of us are living closely, again, multi-generational homes or in apartment buildings, complexes. We don't have a luxury of having a big home with multiple rooms where we can all spread out during our containment period or during our, in shelter period. So we end up infecting each other, and we end up infecting the older patients the older members of our family who are at far more risk, and even the younger members of our community who have these chronic diseases are at greater risk of dying from this stuff.
Wow. So just two quick questions, and one is a very fast one, and this is simply busting a myth, right? There are Black people who feel two things. One is, I can't get it because I'm Black, and two is, I'm young, right? And this is something old people get and die from.
Sure. Well, we definitely know that older people, so what are your risk factors for this disease? Comorbids, which are multiple medical problems. We talked about that. 2, age, definitely a risk factor. Older people, when you get into your 60s, 70s, and 80s, it increases your risk of dying from this. You add age, you add disease to that, and it increases it even more. If you're young, that doesn't protect you. We're still seeing 20s and 30-year-old people who don't even have medical problems. They're not taking medications, who are still getting very sick from this infection and requiring intensive care level care in the ICU, where we're having to put a tube, give them medicine to make them sleep, put a tube into their lungs and connect it to a machine to breathe for them. And early on, when we first started hearing about this, it seemed to be only a disease of white people. White people travel. It was in China. It was their disease. It was those people's disease. It was that country's disease. And then it was here. It was the elite. It's people who are traveling all over the world. But you know what? They brought it here, and now they brought it into our communities, and now we've all spread it.
Yeah.
So, and it is here.
Yeah, yeah, that's definitely, and I'm glad you said that too, because we can get it. And age, right? Age does not make a difference whether you're young or old.
No, it doesn't make a difference because the other factor too is everyone's going to get it. Like I said before, we have no inborn immunity to this.
Yep.
We don't have any protection against this. So you may not get sick enough that it requires you to go to the hospital, right? So out of
Right.
100 people, 80 people will have mild symptoms, maybe headache, body aches, maybe they have some diarrhea, some crampy belly pain. They'll get over it in a few days. But then there's 20 out of that 100 people who are going to require oxygen and respiratory support. So that means you're going to come into the hospital, be admitted, we're going to give you oxygen. And there's 5 of those who are going to need to go into the intensive care unit, who are going to be at risk of dying. Okay. And because there's the vast number of people who have been infected by this is why it's suddenly become potentially a period where that could, or a crisis moment where we can overwhelm our healthcare system. This is why we're hearing about over 700, 800 people dying a day, thousands of deaths in one geographic location because of the density, because we're all close together and this virus spreads very quickly. And if you are young and you're part of that, 80 out of that 100 who's not going to get significantly ill, where you have to go to the hospital, you're going to still spread it to other people who are at greater risk when you go
Yeah.
home if you're not doing something to mitigate or protect your family members from you giving them an infection.
Thank you. I think that's so important that you actually said that, because people need to hear and understand that everyone can make an impact on this, right? The way they act, the way they approach this disease. So we'll end by just asking one thing. And I think this is probably the most important question of them all. What are the 3 to 5 things that people of color can do to save their lives and the lives of their families and friends?
Well, the first thing is to stay home, and that's tough because many members in our community have to work, and
Yeah.
we don't have salary jobs where we can sit home and collect a paycheck and work from the internet. We actually have to go. We're in the service industry. We're doing things, transit. We're doing things. So if you have to go to work, um, you need to wear a mask. If you wear a mask, despite everything that you're hearing, you look at China, you look at other places, people are wearing masks. They're wearing masks in the public. You wear a mask, the whole purpose of social distancing is to maintain 6 feet between each person. Okay, because respiratory droplets will spread at about 6 feet. So that's the purpose of social distancing.
Yep.
If you're going to be in a space where you're going to be in close proximity to each other in less than 6 feet, you got to wear a mask. It protects you from breathing in someone else's germs or droplets, and it also protects other people from you giving them droplets. Right. Certainly, if you might be infected and not know it yet. So the other thing that we need to do in our community is we need to stop smoking weed. You right there, over there. We need to stop smoking cigarettes, and we need to stop smoking weed, because when we smoke, it's like a vehicle. We are giving the virus a ride directly into the deep tissues of our lungs, where they are going to make you the sickest and put you at risk of dying. So you've got to stop smoking now. You certainly can't be sharing cigarettes or sharing your smoke of choice in a community of folks, because you never know who's got it, and you don't know if you're giving it to someone else, and you don't want to expose yourself to the risk of bringing that virus directly into your lung tissue. So you got to stay home. If you can't stay home, go out and cover up and wear a mask. Stop smoking. Okay, now is not the time to be smoking. And the other thing is to start thinking about what you can do to start living a healthy life. People who are getting plenty of sleep, at least 6 hours of sleep, your immune system is far more functional than it is when you're deprived of sleep. And I know it's a stressful time, but take advantage of it and sleep, because your ability to, you get less than 6 hours of sleep. So you've got to sleep. And the other thing is you got to drink plenty of fluids, and you got to try to stick to a healthy diet, which is leaning a little bit more of greens, fruits, and vegetables, and rice and beans, and a little less of red meat and chicken, more fish. We all know what a healthy diet is. And by far, probably the most important thing is we need to limit sugar. Okay, sugar is a chronic source of inflammation. Inflammation disrupts the tissues and the cells, and it puts us at increased risk of developing infections. So limit the sugar, try to eat a healthy diet, and wear your mask, and you got to stop smoking. And that's if you don't stay home. So that's 5.
All right. Look, man, this was absolutely incredible. You are a hero. You and every individual that because you put your life on the line by stepping out there and going into this office every single day to help other people. That is the most selfless thing that a human being can do, is to put their life before someone else's. And I understand that must be a heavy burden, right? You're separated from your family right now. You have been for several weeks. It does not go without saying that me, every single person in this country and in this world appreciate individuals like you who are making this effort, because you're helping to make this world a better place and you're helping to save us. So thank you so much for your time.
And thank you, and to all the other healthcare workers that are out there in the front line making the very same sacrifice, and to all the other essential members of our community who are going out there to try to keep our world moving at a similar pace, despite the rest of us who are being home where we should be. So thank you to you and for allowing this conversation to take place as well. Thank you very much, Will.